This here on Real America. Well, as of this morning, more positive news about the effectiveness of a second vaccine that's just about to be released. Remember last week we told you Pfizer had said their vaccine that they've been developing came out to be 90% effective. That's great news. And then just this morning, Moderna says that theirs is now at 94%. That's amazing. Trump's Operation Warp Speed came into play right here, folks, getting this vaccine out there to hit the streets very, very soon. In a trial, 90 cases of the coronavirus were observed in a placebo group versus 5 cases that received a 2-dose vaccine. Now, in August, Operation Warp Speed gave Moderna $1.5 billion to speed up the development of their vaccine. Moderna working closely with the CDC and vaccine distributor McKesson, which hopes to distribute nearly 20 million doses by the end of the year. The FDA will then work as quickly as possible to safely and effectively approve all of this. But for the very latest information on the vaccines, the therapeutics, and looking forward to the fight against COVID-19, I'm now joined by one of the top docs on the coronavirus task force via the White House, Dr. Scott Atlas, joining Real America. Hey, Doc, thanks for coming on the show. Really appreciate it.
Okay, thanks for having me.
So let's get right off to it. We're looking good on these vaccines. Now a second company saying theirs is 94, 95% positive results here, that it's going to stop the virus in its tracks. Give us some more details behind these vaccines and how they're moving forward, all thanks to your administration with President Trump and the Operation Warp Speed.
Sure. Well, I think it's great news, particularly for our seniors and high-risk Americans, because the vaccines, the 2 first vaccines out of the gate that were under the Operation Warp Speed program have both come forward with data that shows that they're extremely effective, far higher actually than I think anyone could have hoped for. As you said, 94.5% effective, the Moderna vaccine. And so things are moving very rapidly. In fact, exactly in the optimistic timeline, really, that we said many, many times. We, as you mentioned, have close to 100 million doses being prepared by the end of the year, total of the 2 vaccines. And so that, as the original timeline stated, there should be vaccine available for all high-risk priority patients no later than having them vaccinated by end of January, for those who want to be vaccinated, of course.
Yeah, and let's take a step back, Dr. Atlas, because there's been so much disinformation out there from a lot of the mainstream networks that maybe this wouldn't be safe. You have even political leaders like the governor in New York talking about not distributing the vaccines to his people because it came from this administration. This has nothing to do with the administration, except for the fact that you guys got rid of the red tape so that these scientists could do their jobs and get it out faster. But this was done just like we've done for viruses and diseases for decades. These companies have been out doing this type of work for a long time. They're the experts, they're professionals. These vaccines are safe. No corners were cut, correct?
That's exactly right. No corners were cut. No safety corners were cut. The efficiency comes from the president and the Operation Warp Speed effort making the investment, a high-risk investment, of saying, okay, we're going to buy these doses. We're going to pay for the first 100 million doses, for instance, from Pfizer. We're going to do the high-level manufacturing distribution, facilitate that. We're going to de-risk their investment so that everything was sort of, paid for by the taxpayer. Of course, it's the federal government, but we have a pandemic here. And the urgency, of course, was the pandemic, not the politics. And so what happened was the bureaucracy, everything was done simultaneously, and the safety issues were not cut. There is no cutting of corners on safety. We have the safest FDA in the world. The data was held in a black box. Basically, the administration had not even a look at the data. It was done by an expert outside board called the Data Safety Management Board, And the safety issues were actually added beyond the normal vaccine safety, so that you may remember things were changed from 42 days to 60 days after the second dose of a 2-dose vaccine to determine safety. So I think that this was done with the highest standards of safety, as the American pharmaceutical manufacturing industry does. And I'm very comfortable with the safety. And honestly, if I get the chance to take the vaccine, I'm going to take the vaccine.
All right. Well said. Let's talk about the therapeutics, too. There was some great news last week, Doc, about the therapeutics that have come out, similar to some of the stuff that the president did take during his stay at Walter Reed. Let folks know out there that these therapeutics are now coming to a hospital near them, and in some cases already out there, and they're showing great results for folks, especially in that senior category or for folks who had a pre-existing condition, correct?
Right. The big news really is the Lilly drug, which is what's called a monoclonal antibody. And this is a real game changer. This is a dramatic impact drug in that it reduces hospitalizations by 70% in people who have the infection, are symptomatic, and are in the high-risk 65 and older category. I mean, that's really remarkable. That's a life-saving drug. It keeps 70+% of them out of the hospital. These are outpatients, so before even hospitalization. And that's remarkable. And these drugs are not just approved with emergency use. They were then already delivered, in fact, to tens of thousands of sites. I can't remember. There's so many numbers in my head. I'm sorry. But there were most of the states have already received allocations, and therefore deliveries being done, depending upon, of course, the state's process of requesting them. And they are already have been injected into patients in a variety of locations. And again, Medicare did something very good under Seema Verma, and this administration signed an order so that the drugs are not only no out-of-pocket cost, by the way, but this Lilly drug can be administered even inside nursing homes by home health providers. And so the access for this drug, which is very, very important, is really expanded greatly. It's a great example of partnership between private sector and the administration and Operation Warp Speed.
Great news. Let's talk a little bit about testing. I saw an article today said something about we're up to 1.5 million daily. Did I see the correct number? Is that about what you're seeing across our country as far as the tests? And the reason I ask this question is because the mainstream media has played up so much, and certain states' governors have played up so much, all these new positive test results. That's why they're putting lockdowns back in place. But we're also testing a whole heck of a lot more than we were 3, 4, 5, 6 months ago. The president always talks about this. Testing is up. You're obviously going to get more positive results. But the death toll is not going up like it was, and the extreme cases aren't going up like they were. Am I right in that?
Well, I mean, you're partially right.
Okay.
We
That's
are
why you're the
doing a
expert.
massive amount of testing. The testing is over 1 million a day, and there's a massive amount of testing going on. There's no question. That was a system built from scratch under the task force. That was no question that was necessary and needed so that the testing was available. But the point is to use the testing strategically to save lives, to test in high-risk settings, not really low-risk settings. And the testing, of course, does make more cases appear because the more cases are visible, but it's also true. There is no understating that there are a lot of cases. There are hospitalizations going up. There are increased deaths. But what your point is, I think, is that the cases are sort of exploding, and yet the deaths are not exploding like they were in March, April, and that's
right.
Partly because we are getting younger people that have the cases who are healthier and less vulnerable. We are doing better with people who are hospitalized, partly because of drug treatments and other advances in understanding how to treat patients. So the lengths of stays in hospitals are shorter. The fatality rate, if you're hospitalized, is about half of what it was in March, April. But there's no question there's a lot of cases. And, there's no question, there are people who are dying. I mean, that's not to be trivialized at all. We're doing the best we can, focusing on trying to protect the high-risk seniors. Lots of things are being done to protect the seniors, both inside nursing homes and assisted living facilities, as well as alerting seniors who are outside those settings through the Medicare and other agencies internally to get people very aware that you need to protect the elderly with all the mitigation measures that we have. But we also must realize, as we always seem to forget, the harms of the lockdowns. The lockdowns are killing people, destroying middle-class families, sacrificing our children out of schools, And, you know, we really need to get a handle on sort of the whole health policy. We have a lot of people, as we've read, 1 out of 4 young Americans college age have thought about killing themselves during June because of the isolation. We see the tragedy of isolation, even of our seniors now. And with the holidays coming up, people talking about, oh, you cannot leave the nursing home to go visit your family. I think we have to really take into account everyone's health, everyone's life, the impact of the policy, not just the virus. We're doing a lot. The government is supplying as much as possible extra beds in hospitals when requested, extra personnel. There are hundreds of Department of Defense and VA medical personnel and professionals deployed already, sending out drugs, sending out PPE. And everyone has to also, you know, appropriately protect the high-risk people. There's no question about that. But we want to do everything we can to avoid the lockdowns, because the lockdowns really don't work. They're very destructive. And even though places all over the world have done these lockdowns, the cases explode. And the question is, of course, why? Which, you know, we can only sort of surmise. There's a lot of potential reasons, including colder weather, including the fact that when people are indoors, the cases spread more frequently, and that's the problem of delaying the cases into the winter, because then you cannot socially distance from your high-risk family members. Then they're stuck inside the house with you, and we know for a fact that most cases spread indoors in households. So we have to do everything we can to avoid that sort of policy.
Yeah, Dr. Scott Atlas from the White House, we appreciate all of your insight, sir. We know it is a tough thing to juggle the economy with this virus, and I agree with you. We can't continue the lockdowns because the death toll years to come will be way higher than this virus. Thank you so much for coming on Real America. We really appreciate it. We'll let you get back to work. We know you got a lot of work to do. Thank you, sir.
Okay, thank you for having me.
Yep. Don't go away after the break. Time to get real.